I know how difficult it can be to watch someone you love slowly change in ways you can't quite explain. Maybe you've noticed it too. Subtle shifts, a little more fatigue, or an appetite that's just not what it used to be. It's heartbreaking to see someone you care about seem less and less like themselves. We all hope that when the time comes, we'll be ready, but the truth is, most of us aren't. Death in old age rarely comes suddenly. Instead, the body often sends us quiet signals long before it's time to say goodbye. The challenge? Most of us miss these signs, brushing them off as just getting older until it's too late. In this video, I'm going to walk you through 7 critical signs that might indicate your loved one is approaching their final year. These signs often appear long before death, and many of them can be easy to overlook. But recognizing them in time gives you the chance to provide better care, create lasting memories, and ensure their final moments are filled with dignity, comfort, and peace. Stay with us until the end, because I'll be sharing some valuable insights that could help you navigate this emotional journey with clarity and understanding. And if you've noticed any of these signs in someone you love, I want to hear from you. Drop a comment with the number 1 below, so I know you're here and we can connect. Don't forget to like and subscribe. Your support helps us keep creating content that empowers you to care for your loved ones every day. Let's dive in. Number 1, decreased communication abilities. The silent withdrawal. One of the most heartbreaking signs as someone approaches the end of life is a noticeable decline in their ability to communicate. If you notice that a once vibrant loved one has started speaking less or struggling to express themselves, it's a sign that their body and mind are beginning to slow down. Simple conversations may become harder for them to follow, and they may begin repeating themselves or have difficulty finding the right words. What was once a natural flow of thoughts and ideas now feels distant, like their mind is no longer connected with the words they wish to speak. This isn't just a sign of aging. It's often a reflection of the brain's decline. As the body prepares for the final stages, cognitive abilities, including communication skills, are deeply affected. A person may struggle with remembering names, following conversations, or articulating thoughts clearly. Even nonverbal cues like a smile or a look may fade as they withdraw into themselves. Emotional withdrawal is also common at this stage. Your loved one may not engage in conversations as much, and when they do, it may feel like they're disconnected from the world around them. This isn't a sign that they don't care, but rather that their body and mind are retreating into a place where words are no longer the same way they used to be. For families, this shift can feel like a painful loss before the actual goodbye. Watching a loved one become more silent and withdrawn is incredibly difficult, but it's important to approach them with patience and understanding. Instead of trying to force conversation, simply being present, offering quiet companionship, and gently encouraging interaction can help. Remember, even if they can't express themselves the way they once did, they can still feel your presence and your love. If you notice a loved one struggling to communicate or withdrawing emotionally, it's time to be aware. These are often early signs that the mind and body are preparing for the final transition. It's a time to cherish what remains, whether it's a shared smile, a touch of the hand, or just sitting together in silence. If you're experiencing something similar, please share in the comments. We are all in this together. If you're noticing these changes in a loved one or experiencing something similar, please comment 1 below to share your experience. Let's support each other through this challenging time. Number 2, changes in sleep patterns, restless nights. As a loved one nears the final stages of life, one of the most striking changes you may observe is a shift in their sleep patterns. You may notice that they begin sleeping more than usual, or on the flip side, they may struggle to sleep at all. What was once a peaceful night's rest may now be interrupted by frequent waking or an inability to stay asleep for long periods. The rhythms of day and night seem to blur as their body prepares for its final transition. In some cases, they may sleep for long stretches during the day, only to be restless at night. At other times, they may wake up often, confused or agitated, not fully understanding why they can't find comfort. Some elderly individuals nearing the end of life may also experience periods of deep confusion during their sleep, where they may not recognize loved ones or even seem unaware of their surroundings. Sleep disturbances like these are not just a result of aging. They're a reflection of the body's internal processes slowing down. As the body systems begin to wind down, the natural circadian rhythm can become disrupted. It's as if the body no longer knows how to sync with the day-night cycle, and the exhaustion of physical decline often takes over, leaving them in a perpetual state of restlessness. For families, watching a loved one struggle with sleep can be deeply frustrating and heartbreaking. It's easy to assume that they're simply in discomfort or that something needs to be fixed. But the reality is, these sleep changes are part of the natural process, signaling that the body is winding down. What's most important during this time is offering comfort, create a peaceful, calm environment, and allow them to rest as best as they can. If you notice significant changes in your loved one's sleep patterns, don't ignore it. This may be a sign that their body is preparing for the final transition. This is a time to offer reassurance, to be patient, and help them find comfort in whatever rest they can get. If you're going through something similar, please comment below. Sharing our experiences can help us navigate these moments with understanding and compassion. If you're experiencing something similar with a loved one, please comment below. Let's discuss and support each other through these challenging moments with understanding and compassion. Number 3, significant weight loss, a silent signal. Have you noticed someone you love becoming thinner without trying? At first, it may seem like a small change. Perhaps their clothes fit looser, or they're just not eating as much. These subtle signs often get brushed off as part of aging, but in reality, unintentional weight loss is one of the most telling signs that the body may be preparing for its final stage. It's easy to overlook, but it's a warning we shouldn't ignore. As we age, it's normal to experience some loss of muscle mass, but when it happens rapidly, it can signal a deeper, more concerning issue. The body may no longer be absorbing nutrients properly, or it might be struggling to process food and protein, leading to muscle wasting. This loss of strength doesn't just make movement harder. It increases the risk of falls, weakens the immune system, and leaves the person vulnerable to infections. Many elderly individuals also experience a diminished appetite. Food simply doesn't taste the same, and meals may no longer bring the joy they once did. This isn't about preference. It's the body's way of signaling that it's beginning to shut down. As appetite fades, so does strength and energy, which gradually leads to a decline in overall health. Weight loss can also be a symptom of chronic illnesses like cancer, heart failure, or kidney disease, conditions that may progress quietly over time. Depression and cognitive decline can also contribute to a reduced desire to eat, further exacerbating the problem. While families may try to solve the issue by encouraging more food, favorite meals, or protein drinks, it's important to realize that this is more than just a diet problem. The body is preparing for something deeper, and at this stage, forcing large meals won't help. Instead, focusing on comfort foods, easy-to-eat meals, and staying hydrated can do wonders for their quality of life. If you're noticing significant weight loss in an elderly loved one, especially if they're eating less, feeling weaker, or struggling to stay active, it's time to take this seriously. It's not just about how they look. It's the body trying to tell you something. Understanding this message can help you approach the situation with compassion, clarity, and the ability to make the most of every precious moment. If you noticed any of these changes in someone you care about, drop a 3 in the comments. Let's talk about it and support each other during these difficult times. Number 4, extreme fatigue and weakness, a silent struggle. Have you ever witnessed someone you care about slowly lose the energy they once had, as if it's been drained from them piece by piece? It's heartbreaking to watch, and for many, it's one of the most painful parts of the final stages of life. Extreme fatigue, the kind that doesn't fade no matter how much rest they get, becomes overwhelming. Simple tasks, like getting out of bed, walking across the room, or even talking, suddenly take immense effort. This is no longer just feeling tired after a busy day. It's a deep, persistent exhaustion that's difficult to explain, yet impossible to ignore. This isn't merely a product of aging. It's the body signaling that it's using its energy for survival, prioritizing only the most essential functions. As the organs slow down, the heart pumps less efficiently, circulation weakens, and muscles are deprived of the oxygen they need. That's why so many elderly individuals in their final months experience profound weakness, unsteadiness, and the inability to perform everyday activities that once felt effortless. Another major factor contributing to this fatigue is the slowing metabolism. The body, which once had energy to move, now redirects in a more focused way towards simply keeping vital functions going. The energy that used to fuel movement is now preserved for survival. It's no surprise, then, that someone who's nearing the end may sleep more, take longer naps, and struggle to stay awake for long periods. Sometimes, you may notice a sudden shift in their energy levels. They seem fine one moment and completely drained the next. Yet, it's the emotional toll of this constant exhaustion that can be the hardest for both the person experiencing it and their loved ones. Many seniors, who once prided themselves on their independence, may begin to feel embarrassed or frustrated with their lack of energy. They may pull away from social interactions, stop participating in hobbies, or avoid conversations. Not because they don't care, but because they simply don't have the strength to engage anymore. This emotional and physical withdrawal often leads to a cycle of isolation, which only speeds up the decline. For families, it can be incredibly painful to watch a loved one who was once vibrant and full of life now become exhausted and withdrawn. It's easy to mistake this for laziness or a lack of will to push through, but the truth is, pushing them to keep going only does harm. What they need most is understanding. It's crucial to recognize their limits, let them rest when needed, and make their remaining time as comfortable as possible. If you see someone struggling with this deep, unrelenting fatigue that rest can't seem to cure, understand that this is a sign of a significant transition. Now is the time to cherish the quiet moments, to listen, and to offer support without any expectations. What matters in these final moments isn't how much they can do. It's that they feel loved, understood, and at peace. If this resonates with you, and you recognize these signs in someone you care about, please comment number 4 below. I'd love to hear your thoughts and connect with you. And if you haven't already, be sure to subscribe and turn on the notification bell so you don't miss out on more videos that can help guide you through these important moments. Your support helps us continue to share valuable insights. Now, let's continue. Number 5, increased cognitive confusion or withdrawal, the struggle of the mind. As we near the end of life, one of the most profound changes we can witness is in the way a person thinks, communicates, and connects with others. It's heartbreaking to see someone who was once sharp and engaged begin to forget things that were once second nature. Perhaps they struggle to follow conversations, get disoriented in familiar places, or repeat themselves without realizing it. You might notice them forgetting names or losing track of time. Things that were never an issue before. These subtle shifts in memory and cognition often begin months, sometimes even a year before death. It's not just simple forgetfulness. The brain, like every organ, requires a constant supply of oxygen and nutrients to function properly. As the body weakens and circulation decreases, the brain's ability to perform starts to fade. This leads to confusion, difficulty in making decisions, and trouble recognizing familiar people or places. In some moments, a person may seem completely clear-headed, only to suddenly lapse into confusion again, as if their mind is drifting in and out of reality. It's a jarring experience for both the person going through it and those who love them. Another difficult sign is emotional withdrawal. When someone is nearing the end of life, they often lose interest in socializing. They may speak less, engage less, or even sit in silence for long periods. It's not that they don't care about those around them. It's just that their brain no longer processes emotions and engagement the same way. Conversations become draining, noise becomes overwhelming, and eventually, many seniors retreat into their own inner world. You may also notice changes in their mood and behavior. Some become irritable, anxious, or easily frustrated. Others may seem oddly calm, distant, or indifferent to things that once brought them joy. This is not a personality shift. It's the brain adjusting to the physical decline. As cognitive function slows, expressing emotions becomes more challenging, and they may react to situations in ways that seem unlike themselves. For family members, this stage is often the most difficult. Watching a loved one lose touch with reality or pull away emotionally can feel like a second loss, even before they are gone. But it's important to remember, this is not something they can control. Rather than trying to bring them back into conversations, it's crucial to meet them where they are, speak softly, offer reassurance, and remember that even if they can't respond, they can still feel your presence. If you've noticed a loved one becoming forgetful, more confused, or withdrawing emotionally, don't brush aside. These are signs that their mind and body may be preparing for the final transition. Now, more than ever, it's a time for patience, for cherishing those quiet moments together, and for creating a space that feels safe and familiar. Because even when words fade, love and comfort remain. If you've noticed these changes in someone close to you, please comment 5 below. I'd love to hear your story and connect with you through this shared experience. Number 6, frequent infections and slow healing, a hidden struggle. As the body prepares for its final phase, one of the most obvious and yet often overlooked signs is a weakened immune system. If you notice that someone who rarely got sick before now seems to catch every cold, every flu, or even the slightest infection that comes around, it's a sign that their body is no longer as resilient as it once was. What used to be minor illnesses now seem to linger for far longer, and simple injuries like a small cut or bruise take an unusually long time to heal. These changes aren't just coincidental. They are clear indicators that the body can no longer defend or repair itself the way it once did. Repeated infections become a major concern. Pneumonia, urinary tract infections, UTIs, skin infections, and even oral infections can become much more common as the immune system weakens. What many families may assume are isolated incidents often turn into recurring events. And when infections take too long to heal, it's a sign that the body's ability to fight back is diminishing. Even antibiotics, which once worked swiftly, may now seem ineffective. The person may need stronger medications, extended recovery times, or multiple rounds of treatment for infections that once would have been easily managed. This happens because as circulation slows and organ function declines, the body simply can't respond to treatments the way it used to. Chronic wounds are another troubling sign. If you notice that small cuts, bruises, or sores aren't healing properly, or if they keep reopening, it could point to poor circulation. Without adequate blood flow, oxygen and nutrients aren't reaching the skin and tissues effectively, making recovery painfully slow. For those who are less mobile, pressure sores become a serious risk, potentially leading to infections that can be difficult to control. What's even more concerning is that infections in the final year of life often don't show up the way we expect. Instead of high fever, you might find that your loved one seems unusually tired, more confused, or less interested in eating. In fact, a sudden drop in mental clarity is often the first warning sign of an infection, even before any physical symptoms show up. This is why recognizing these signs early can make such a difference. The earlier you notice these subtle changes, the better able you'll be to provide the right care and comfort. For families, it's heartbreaking to watch a loved one go through the cycle of recurring infections. It's easy to fall into the trap of wanting to push for more treatments, hoping that another round of antibiotics or one more hospital visit will fix things. But at some point, the focus needs to shift from curing to comforting. Hydration, gentle skin care, and reducing stress on the body can often provide more comfort than more aggressive treatments, which may only prolong suffering. If you found yourself dealing with this, understanding the deeper needs of your loved one can offer some peace during a difficult time. If this resonates with you, and you're noticing similar struggles with a loved one, please comment number 6 below. Let's support each other through this. And don't forget to subscribe and turn on notifications so you never miss the insights and support that could help in your caregiving journey. Number 7, major changes in breathing and circulation, the body's quiet shift. As a loved one nears the end of life, one of the most profound and telling changes is in their breathing and circulation. You may begin to notice their breath becoming more shallow or slower than it once was. There might be moments when they pause between breaths, or their breathing pattern may become erratic, speeding up and slowing down without warning. Some people experience a rhythm known as Shane Stokes respiration, where their breath alternates between deep, rapid inhalations and long, quiet pauses. Initially, these changes may seem subtle, but over time, they become more noticeable and frequent. Alongside this, circulation weakens. You might notice their hands, feet, or even nose and ears feeling cold to the touch. Their skin may take on a pale, bluish, or mottled appearance, especially around the extremities, such as fingers and toes. This shift happens because the body starts directing blood flow to vital organs, reducing circulation to the outer parts. It's a clear sign that the heart is no longer pumping as forcefully as it once did. Another significant sign is increased shortness of breath. Even with minimal effort, simply sitting up, speaking, or shifting positions might cause them to become winded. You may see them breathing through their mouth more often or needing to pause mid-conversation to catch their breath. Activities that were once effortless, like walking across a room, may now feel like an overwhelming challenge, signaling a decline in lung function. In some cases, fluid can build up in the lungs, making breathing even harder. This can result in a persistent cough, gurgling sounds, or a sensation of tightness in the chest. While some may mistake this for congestion from a cold, for elderly individuals nearing the end of life, it's often a sign that the lungs are weakening. This can make lying flat uncomfortable, and they may prefer to sleep propped up on pillows or in a recliner to ease their breathing. For families, witnessing these changes can be deeply unsettling. It's natural to want to help, to encourage them to take deeper breaths, or to worry that something more urgent is happening. But in many cases, these changes are simply part of the body's natural process of slowing down. Though it may feel like something needs to be fixed, often, the most helpful thing you can do is ensure they are comfortable. Keeping the room cool, using a humidifier, and offering small sips of water can provide some relief and ease their discomfort. Medications or oxygen therapy can sometimes offer temporary relief, but at this point, the focus should shift from trying to fix the issue to providing comfort. If you notice changes in their breathing, cold hands and feet, or a bluish tint to their skin, it's essential to pay attention. These signs are often indicators that the body is conserving its energy and slowing down circulation. It's a time to simply be there for them, to offer reassurance, and create an environment where they feel safe and at peace. In these final weeks or months, the most valuable thing you can provide isn't more medical intervention. It's comfort, dignity, and the quiet knowledge that they are not alone. If you're noticing these changes in a loved one, I'd love to hear from you. Please comment number 7 below to share your experience, or if you're going through something similar. Let's support each other through this challenging time. Final reflections. As we wrap up this video, take a moment to reflect on the signs we discussed. Significant weight loss, overwhelming fatigue, cognitive decline, frequent infections, and noticeable changes in breathing and circulation. These 7 signs often emerge in a year, leading up to the passing of an elderly loved one. They might not all appear at once, and they may not be immediately obvious, but when you begin to notice them, it's a signal that the body is gently preparing for its final transition. For many families, acknowledging these changes can be deeply challenging. It's natural to want to fight against them, to encourage a loved one to eat more, move more, or push through the exhaustion. But sometimes, the most loving thing we can do is to listen to the body's quiet message. Rather than trying to reverse the inevitable, we can focus on making their remaining time as peaceful, comfortable, and filled with meaning as possible. Understanding these signs isn't about fearing the end. It's about being ready for it. By recognizing these changes early, you can offer better care, make thoughtful decisions ahead of time, and ensure your loved one's final months are filled with love, dignity, and respect. This is a precious time to cherish the moments, share stories, and remind them how much they are valued and not alone. If you're noticing these signs in someone close to you, take a deep breath and remember, you are not alone on this journey. Many families have walked this path before, and though it's never easy, knowing what to expect can help bring you strength, patience, and peace. Thank you so much for joining us today. We'd love to hear from you. Please leave a comment below and share something you've learned from this video and how you plan to apply it in your own life. Your thoughts mean so much to us, and reading your comments motivates and encourages us to keep sharing valuable content. If you found this video helpful, please like, subscribe, and share. Your support allows us to continue creating content that inspires and informs. Thanks again for watching, and we look forward to seeing you in the next video.